This video is going to be a bit different than our other videos. Today, we're going to talk about inclusive language in healthcare. For the past year, the team here at Figure One has been making a conscious effort to make language in our content more inclusive. When applicable, we've been using people-first language, such as the phrase people with diabetes instead of diabetic, or immunocompetent person instead of healthy person, as well as gender-inclusive terms. These are just a few of the changes that we've made and will continue to make. We believe that these changes are important because language plays a key role in building strong working relationships with patients. Recently, we posted content on the Figure One app that made a segment of our user base upset. In this post, we used the phrase assigned male at birth when giving the clinical history of a patient. In hindsight, since gender was not relevant to the case, we should have probably admitted it. But we were caught off guard at the number of users who expressed frustration that we had chosen that phrase instead of simply saying male. Of the roughly 2,000 healthcare workers who saw the post, about 1.5% of them felt compelled to object to our language in the comments. Of course, this is a small minority and is not representative of the Figure One users overall, but unfortunately, this 1.5% represented over 90% of those who commented on the post, a small but very loud minority. And so, this seems like a good opportunity to introduce a conversation about inclusive language. Reading through the comments of our post, some of our users seem to reject the use of gender-inclusive language altogether, regardless of the context. Other users felt gender identity is political and unscientific, whereas a person's sex, male or female, is a scientific fact. And some users also seem to feel that gender identity language was fine outside of medicine, but incorporating it into the larger medical lexicon would negatively impact the profession. So let's start by dispelling the myth that sex is binary. It's not. Chromosomal and anatomical genital variations are well established in medicine, and it's estimated that between 0.02 and 2% of people are born with these variations. The range of prevalence is wide because the larger medical community hasn't agreed upon the definition of someone whose sex isn't male or female. While a majority of people can be labeled as one sex or the other, not everyone can, and so, scientifically speaking, sex isn't binary. So then, can using gender-inclusive language negatively hurt the healthcare profession? Absolutely not. In fact, not using it is very likely to cause significant harm. One of the primary objectives of all healthcare professions is to build and maintain strong relationships with patients. Relationships built on trust and respect. Patients who trust their healthcare providers access the healthcare system more often, they're more likely to listen to advice from their healthcare provider, and participate more in their healthcare plan. An easy way to erode a relationship with a patient is to use language that they find offensive. It doesn't matter if you say it to them directly, write it in the patient's chart, or discuss it in academic literature. Patients can easily access their medical records, and they read medical literature too. If we want to maintain the trust of our patients, we need to be using inclusive language everywhere. In October of 2021, the president of the American Medical Association wrote a public letter to coincide with the association's release of an inclusive language toolkit that they developed. We like how he phrased the issue. The dominant narratives in American medicine and society reflect the values and interests of historically more privileged socioeconomic groups: white, heterosexual, able-bodied, cisgendered, male, wealthy, English-speaking Christian US-born people. These narratives have been deeply rooted in value systems and ingrained in cultural practices that have given preference to the interests of society's most powerful social groups. But they can also be wielded as a weapon to oppress others. Over the last few years, many professional healthcare bodies, like the American Medical Association, have officially recognized the importance of using inclusive language in their communications. They also have become important allies in supporting and encouraging their memberships to move towards more inclusive language. They recognize the importance of encouraging healthcare to evolve with social progress. But there are benefits to inclusive language that go beyond just being respectful to our patients. Because we're now using a lexicon that is more specific, we can collect better data. Part of the reason why some people may believe that gender-inclusive language is unscientific may be because there isn't much research that captures transgender and non-binary people. The thing is, if we don't acknowledge these groups in our language, then we're less likely to include them in our research. So let's be inclusive in our language and research so that we can learn more about these groups of people and their health. And actually, we're beginning to do that already. In 2022, Canada was the first country to publish transgender and non-binary data from its census. The data showed that almost 1% of people between the ages of 20 and 24 identify as transgender or non-binary. That's a small but growing portion of the population. Transgender and non-binary people have specific health needs such as hormone treatment, and they're also at a higher risk for suicide. The census highlights the need for us to adopt inclusive language quickly so that we can cater to the needs of these patients. As we all move towards refining our language, we're going to make mistakes. We're not going to get it right every time, and our language will continue to change and evolve. And that's okay. Our patients and colleagues understand that, and hopefully, we can be patient towards one another. Over time, we will get better, and eventually, it will become second nature. The most important thing is that we try. By making an honest effort, we will strengthen our patients' trust and respect in us. So that's why here at Figure One, we're going to continue to create content that promotes inclusive language within our community. And we hope that you will join us in moving our professions forward.